This OSCE video will guide you through what you should be looking for on a cranial nerve examination in an OSCE scenario, followed by a full run-through of what it should look like. Candidate instructions. Please examine this patient's cranial nerve system and present your findings within 6 minutes. As you enter, wash your hands. Introduce yourself to the patient, including your role. Check the patient identity, gain consent, and ask for a chaperone if necessary. First, check if the patient has any pain. Look at the general appearance of the patient. Look for any asymmetry, ptosis, abnormal pupils, or glasses. The olfactory nerve is tested by asking the patient if they've had any change in sense of smell, and then asking them to smell a common substance. If you detect abnormality, perform the test with separate nostrils. The optic nerve is assessed using several tests. First, check for visual acuity using a Snellen's chart. Then check for visual fields, comparing your visual field to that of the patient. Assess for blind spot. Check the pupillary light reflexes. Then assess for accommodation and check for sensory inattention. You may also perform a fundoscopy. The oculomotor, trochlear and abducens nerves are tested by moving your finger in a H movement in front of the eyes, asking the patient about blurred or double vision, looking for nystagmus, and looking for any failure or movement of the eyes. The trigeminal nerve is assessed in multiple ways, first assessing the sensation in the 3 regions of ophthalmic, maxillary and mandibular, checking the muscles of mastication, assessing a jaw jerk reflex, and testing a corneal reflex. The facial nerve has 2 components. First, ask if the patient has any change in taste. Then ask them to perform a series of facial movements testing all branches of the facial nerve, looking for any obvious asymmetry. To test the vestibulocochlear nerve, first ask the patient if they have any balance problems. Then test their gross hearing by whispering a number into each ear. Perform Rinne's test and Weber's test to determine conduction. The glossopharyngeal nerve is tested by asking the patient about any swallowing difficulties and performing a gag reflex. The vagus nerve can be tested by looking at palatal and uvulal deviation. Assess the accessory nerve by asking the patient to shrug their shoulders against resistance and turn their heads into your hands to check for sternocleidomastoid. Test the hypoglossal nerve by asking the patient to stick their tongue out, looking for any deviation or wasting, and then check the power of the tongue by asking them to push it into the side of their cheeks. Conclude your examination by thanking the patient, summarizing your findings, and performing a peripheral nervous system examination on the upper and lower limbs.
Hello, my name's Sam. I'm one of the third year medical students. Can I check your full name and date of birth, please?
Anna Prajapati, 11th to the 9th, 87.
Thank you, Anna. Today I've been asked to do an examination of the nerves of your face. This will involve me asking you to do some movements and checking the sensation in your face. Would that be okay?
Yeah, sure.
Before we begin, do you have any pain in your face?
No.
Okay. On general inspection, I can't see any obvious nerve palsies. The face is symmetrical and there's no abnormal movements or posturing. I'm going to begin by checking the olfactory nerve, cranial nerve 1. Have you noticed any change in the sense of smell lately?
No.
I'd like you to close your eyes for me and smell this well-known substance. Can you tell me what that is, please?
Coffee.
That's right, thank you. I'm now going to check the optic nerve. Have you noticed any changes in your vision?
No.
Okay. I'd like you to cover your right eye and read the lowest line of the Snellen chart that you can.
E, D, N, Z, F, H, P, U.
That's perfect. And cover the other eye. And the same again, please.
E, D, N, Z, F, H, P, U.
That's perfect, thank you. I'm now going to check your peripheral field. So if you could cover your right eye for me, and I want you to say yes when you can see my hand in the corner of your vision.
Yes.
And again.
Yep.
Okay, keep that eye covered.
Yep. Yep.
That's fine, so cover the other eye for me. And the same again, so yes when you can see my hand.
Yep. 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 Yep.
Okay, and now I'm going to check for your blind spot. So if you cover your right eye again, I want you to keep your eyes fixed on me. Tell me when the red spot disappears, say yes.
Yep.
And when it reappears,
Yep.
that's fine, that was the same as me. Cover the other eye for me. And the same again, keep your eyes fixed on me, say yes when it disappears,
Yep.
and yes when it comes back.
Yep.
Again, that was the same as me. I'm now going to check your pupil responses, so just bear with me while I shine this light in your eye. So normal direct, and consensual, direct, and consensual reflexes. I'm just going to check for accommodations. If you could look to the top right hand corner of the room for me, and when I say, look at my finger, so the accommodation was normal. Finally, I'm going to check for inattention, so if you could point to the hand that you can see moving. And now, that's perfect, thank you. I'd also like to perform fundoscopy, but I'm not going to do that today. To check cranial nerves 3, 4 and 6, I'd like to keep your head still, follow my finger, and let me know if there's any blurring or double vision. And I'm also checking for nystagmus, which is not present.
Okay.
Thank you. So for cranial nerve 5, we're going to check the sensation in your face. This is hard, and this is soft. Let me know when you close your eyes whether you can feel hard or soft for me. So close your eyes for me.
Hard, hard, soft, 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 hard, soft, 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 hard, hard.
Okay, that's fine. And open your eyes again. Please clench your jaw for me. That's a normal master bulk. And open your hand against my arm. Perfect. I'm now going to perform the jaw jerk. Don't worry, very gentle. So that's the normal reaction, no response. I could also perform the corneal reflex, but I'm not going to do that today. I'm now going to test the facial nerve. Have you noticed any change in your sense of taste?
No.
Okay. I'm going to ask you to do some movements for me. So if you could screw your eyes up for me, and don't let me open them. Raise your eyebrows as high as you can. Blow out your cheeks, and don't let me push them in. And if you could purse your lips for me, that's perfect, thank you. I'm now going to check the vestibulocochlear nerve. Have you noticed any change in your hearing or your balance?
No.
Okay. I'm going to whisper a number into your ear if you could tell me what it is.
99. 32.
That's fine. I'm going to give you two sounds, sound 1 and sound 2. Please let me know which is the loudest. Sound 1 or sound 2?
1.
Okay. And again, sound 1 or sound 2?
1.
Okay, and that's normal because air conduction should be better than bone conduction. I'm now going to place the tuning fork in the middle of your forehead. Let me know if you can hear the sound louder in either ear or the same.
Same.
That was Weber's test and that was normal, thank you. So for the glossopharyngeal nerve, I'd like to know if you'd had any problems with your swallow.
No.
Okay, and I could also perform the gag reflex, but I'll not do that today. For the vagus nerve, I'd like you to open your mouth and say ah for me. So there's no palatal or uvular deviation, that's fine, thank you. For the accessory nerve, can you push your hands against your shoulders against my hands? Thank you. And against my hand again, and again. So that's entirely normal. And for glossopharyngeal, finally, can you stick out your tongue for me? And move it from side to side. Thank you. Push against my hand, and against my hand. So the muscle power is normal, there was no wasting of circulation. Thank you very much, Anna. That concludes our examination. In summary, that was a normal examination of the cranial nerves of Anna's face. To conclude the examination, I'd also like to perform an upper limb and lower limb neurology examination.